Good evening, everyone. We're going to get the evening started. I do know that there's some people still making their way in, and they'll be seated as we get the formalities out of the way. I'm Mayor Barry Manuel, and on behalf of the Town of Grand Falls-Windsor and our council, I'm happy to welcome you here tonight and to tell you a little bit before we get going about what you can expect tonight and what this is all about. I mean, essentially, as everyone knows, I'm sure you've heard that we now have a family care team in the Grand Falls-Windsor region. And that means a lot of different things to a lot of people is what I learned. And there seems to be a lot of confusion out there. You know, we have a lot of terms, the health hub, and there's 811, and you got your family practice, and Medicare, and there's all kinds of different things that you hear, and people really need to get some clarity. So we're hoping this can help that tonight. And it is driven by the Town of Grand Falls-Windsor through the Health Coalition. And Mr. Cyril Farrell is here. He will be doing a presentation shortly or having a few words. And we also have Denise Spencer here from the coalition, and she'll be doing a presentation on the social determinants of health, one of the things we've been focused on. And as a committee, you know, we really lobbied hard for this family care team, and we continue to lobby government for other essential needs here, including, you know, the nursing school and making sure that's sustained and able to grow and maybe have additional programs there. We've got the whole residency training program. Grand Falls-Windsor has always been a great place for residency training, and there's a lot of examples of doctors who did the residency here and either stayed here or certainly very much enjoyed the experience and being here in Grand Falls-Windsor. We also have this Center for Aging and Excellence in Aging that the government are going to be unfolding in Central Newfoundland, so we're keen to get government to talk to us about how that's going to be rolled out and what our role can be there. And of course, the recruitment retention piece is always a big piece for us. And we've done a number of events over the last year. We had a lot of residents out and doctors, physicians, and families. And we've had family days, we've had picnics, we've had barbecues, we've had all kinds of things just trying to get those groups together and be able to show them what we have to offer here in Grand Falls-Windsor and why they should choose here if they do indeed have a choice, which many physicians, both family practice and specialists, do. So, a couple of formalities to take care of. We do have the emergency exits, for anybody doesn't know, are up here at both sides of the stage, and there's washrooms at the back. You can see those as you go back. And of course, we are looking to have a Q&A after the presentations. So we expect that we're going to be looking to have this wrapped up by 8:30. The presentations are not overly long. We want to have some time for questions and answers, obviously ample time, but that is the target that we're going to be shooting for. And of course, you'll hear more about this and heard a lot already, I'm sure, about Patient Connect. And for those who don't have a family physician, that Patient Connect is the place where you would go, .com, to put your name, to be able to add your name to the list of people who want to get in to be a patient of the family care team. And we do have a lot of professionals here tonight from the family care team. They're seated over here to my right, your left up front. And it's a work in progress, of course. As we know, capacity is always an issue when it comes to health care, everywhere, not just here, but it seems everywhere these days, and you'll hear more about that. And I also have Janet Morgan Little here. She's on the stage, and she will be doing a presentation shortly as well. And Dr. Jared Butler is also on the stage, as is Cyril Farrell, the chair of our coalition. So without further ado, what I'd like to do is pass it on to Janet Morgan Little, who will do a short presentation now on the family care teams. Thank you.
I'm just going to move this way down. All right. Thank you, Mayor Manuel, for your introduction. On behalf of Newfoundland and Labrador Health Services, I'd like to welcome everyone here tonight, and thank you for taking the time in your evening to attend this session. I'd like to acknowledge that members of our senior leadership team are here, as well as Joanne Pelly, who is the Vice President and Chief Operating Officer for the Central Zone, as well as the Chief Nursing Officer for the province. Also in attendance, we have our family care team staff members. We have our registered nurses. I'd like them to stand. They really didn't want me to do that. This is our team of registered nurses, licensed practical nurses, social worker, pharmacist, physiotherapist, dietitian, and of course our clerical support. She holds the glue. She's the glue that holds us together. We do have a few team members that were unable to make it tonight. Anne Blackmore is our nurse practitioner, as well as Christina King. She's another registered nurse with the team. So now that you've met the team and the leadership, let's talk about what we'll cover this evening. We will be providing information on what a family care team is, how you can access a family care team, what the process is once you're called for your first appointment, and lastly, we'll highlight some of the other primary health care services. So the Health Accord was released in 2022, and it outlined a 10-year health transformation action plan for our province. The Health Accord outlined that every person in Newfoundland and Labrador will have timely access to social and health services and to continuous care as part of a well-connected network. The structure will be enabled and strengthened by interdisciplinary teams working collaboratively with individuals and their families and focusing on all aspects of health and wellness. The Health Accord identified 35 teams across the province. 8 of those are located in the Central Zone. The Exploits Family Care Team includes all communities from Buckens right to Botwood and down to Cottrell's Cove and all those surrounding communities. It is one of the largest teams on the island. This team works within a hub and spoke model. The hub, which is the larger site, is located here in Grand Falls-Windsor. And the smaller clinics, or the spokes we call them, are planned for Buckens, Bishops Falls, and Botwood. The Grand Falls-Windsor site saw their first patient for intake on November 29th, 2023, and to date we have onboarded 265 patients. Healthcare isn't a one-size-fits-all. Every person and community is unique, and therefore we need to take a needs-based approach to planning teams and an individualized approach to care. The family care teams aim to improve access and continuity of primary health care. An interdisciplinary team-based model of care, and it provides seamless access to multiple healthcare professionals who will focus on meeting the health and social needs of individuals and their families. So team-based care has shown to improve continuity of care. And when we talk about continuity of care, we're referring to the ongoing relationship between a person and their primary care provider and the family care team. This continuous relationship with a primary care provider allows the development of a trusting relationship, which is the foundation of a patient's medical home. These teams are supported and enabled to provide patient-centered care that is collaborative, compassionate, and seamlessly connected across the healthcare system. With timely access, people are more likely to seek out and maintain attachment relationships. When family care teams offer satisfactory access to service, so this may include moving forward walk-in type clinics, evening and weekend clinics, same-day access, and use of virtual care technology. Chronic disease management and improved health outcomes, provider satisfaction and work-life balance, and reduce emergency room visits, hospitalizations, and entry into long-term care. So how does a family care team support me? A family care team provides a wraparound, community-based access to an interdisciplinary team to work with you to support your health and social needs. It's what's most important to you. The goal is to connect you with the right care in the right place at the right time by the right provider. The team will be using the electronic medical record, or EMR we call it, which will support the flow of information across and between providers. So each team will look a little bit different with respects to the positions that we have on each team. Existing programs and services will also work collaboratively with the family care teams. You'll see to my right the positions that are part of the family care team. At the Grand Falls-Windsor site, all of these positions will be present. There are primary care providers allocated for each site, so both hub and spokes. And the team resources support each site. So how do I find the family care team? Family care teams are at various stages of development across the province. If you do not have a primary care provider, register with Patient Connect. Newfoundland Labrador Health Services use Patient Connect list to call patients when the family care team starts in their area. So you can register online, or you can certainly, if you're not comfortable with registering online, you can certainly call the number provided. So for those of you who do not know what Patient Connect is, it's a provincial list of individuals who have identified as being without a primary care provider. So that's a family doctor or nurse practitioner in Newfoundland and Labrador, or will be without one in the next 3 months. The information provided on Patient Connect will be used to plan and improve access to primary care in Newfoundland and Labrador, with the goal of connecting individuals to a family care team in their area when they open. So the next slide is really hard to see, and I do apologize for that, but we really wanted to give an idea of what the website will look like. So when you log on to Patient Connect, or you go into Google and you Google Patient Connect, and when you go into register, this is what the screen will look like. You would just need to fill in all of the required fields. So a little bit about our attachment process. So like I said, you're going to register on Patient Connect NL. When we're ready, you will be contacted by our clerical support, and she'll call you for an appointment for an intake. We call all patients on a first-come, first-served basis. So the patients are booked with an intake assessment with the RN. Our intake assessments generally take about 60 minutes, but it really depends on the patient's medical background. So if they have a complex medical background, it might take longer. If there's not a lot there, then it will be shorter, of course. So that intake might look like a best possible medication history. It will be a record of your surgical history, your medical history, and family history. We also ask about the social determinants of health. So while you're giving your information to the RN, she's going to be certainly putting that into the electronic medical system, medical record, and we're building your patient in EMR, building your profile, in EMR. So once that intake assessment is completed by the RN, you're then booked with an appointment with the provider. So you're going to have your initial appointment then with the provider, and that might look like a family physician or a nurse practitioner, depending on the team that you're attached to. So during intake or at any point in time when you have contact with the team, referrals are sort of coming and going through team members. So it might be that the nurse on intake might identify that maybe, and the patient may identify that they would like to speak with a pharmacist. So that internal referral is then made. It might be the social worker, it might be the physiotherapist. So at any point in time when you're having contact with the team, those tasks or referrals are constantly coming in and out. So this is how we communicate. So our next steps. Things are happening very fast. Things are changing very rapidly. So ongoing recruitment is happening. Also staff orientation. So as you can imagine, staff are coming to us from all units, all departments of both acute care, community, all different places. They're coming with a lot of different backgrounds. So they're all really at different stages of orientation. Promotion of Patient Connect NL. Again, this is our list, our wait list. So we want to ensure that everyone has access and the capabilities to register. Host community engagement sessions and education sessions like we are doing tonight. And ongoing quality improvement and evaluation. As you can imagine, this is something that's very new, brand new, so we are constantly trying to improve upon our processes, determine new pathways, so we're doing a lot of quality improvement multiple times a day. So lastly, I'd like to talk about other access points available for episodic primary care. So listed first is the Health Hub. This service is for residents who have non-emergent medical issues, who do not have a family physician, or whose family physician is not available. Patients can call the clinic to set up an appointment. 811 is another access point. It is the health line. It's a confidential and free telephone line staffed by experienced registered nurses. It is available to all residents of Newfoundland and Labrador, day or night. The health line also has a nurse practitioner virtual care service. Appointments are available from 8 a.m. to 8 p.m., including weekends. And lastly is Teledoc. As part of the provincial government's continued efforts to reimagine healthcare in the province, NLHS has launched a new virtual care solution that will increase access to healthcare for rural areas and residents who do not have a primary care provider. The virtual care service will include virtual primary care for residents who do not have a primary care provider and have registered with Patient Connect. This access will be through a virtual physician available Monday to Friday, 8 a.m. to 8 p.m. So if you have registered with Patient Connect or you are on another provincial wait list and have a valid MCP, you'll receive a letter in the mail informing you of how you can access this virtual care service. These are episodic access points, and they are of no charge, so they're of no cost to the patients. And that's the end of this portion of my presentation. We'll be here at the end for questions for sure. And again, thank you for coming tonight.
Thank you, Janet. Mentioned the Health Coalition a number of times, and for people who are familiar, we had almost a year ago now, hard to believe, in this theater, we had a session where we gathered people, and it was an effort to, lobby the troops to make sure that our voices were being heard, at least from town council's perspective. That's what we wanted, government to hear us. And obviously we've been somewhat successful in that we have a family care team. But it is because the people who were here and the people who we connected with after through the coalition and the letter writing campaign and the emails and all the people who agreed to be on a list for information from the coalition, you all had a part to play. So I just want to make sure that I thank everybody who did their part, and there'll always be more, I'm sure, to do in the future, but it's important for us to be engaged, especially with healthcare in this day and age. And the coalition is chaired by Mr. Cyril Farrell. I'm going to mention quickly the others. Denise Spencer, who I mentioned doing a presentation, is actually here on stage as well. I forgot to mention that Denise was on stage. And we also have a number of people who served but are no longer with us, and I'd like to thank them as well. Ruth Down Robinson, I know Ruth is here tonight, I did see her. Ellen Foley, David Sutherland, Alan Bradley, all were with the coalition but stepped away for a variety of reasons. Marg Power is also a member of our coalition, as is Reg Hamilton, and of course Councillor Holly Dwyer is the council liaison on that committee. So, what we wanted to do next is talk a little bit more about the family care team, but it'll be more from a personal perspective. The chair, Cyril Farrell, has had experience with it, and he would like to talk about his experience and hope that that will be helpful in anyone here who needs to access the family care team as your primary care provider. Because that's what happens, as everybody could see through Janet's presentation. The family care team is a team that works together, and they intake patients, and you become a patient of that team. So it's an important distinction to make, and these other services are available, but certainly people who don't have a family physician and are looking for one patient connect and getting connected to the family care team is important. So I'll ask Cyril Farrell now if he would come forward, and you know, every time I talk about Cyril, I can't help but tell you how much work he's done himself. He's a real go-getter, and certainly when we approached Cyril originally to take this role on, we got the right person, because he has put so much time and effort on a volunteer basis into this on behalf of the town and behalf of you, the citizens. So I want to thank Cyril for all his hard work, because I can tell you he's had an important role to play.
Thank you, everyone, and thank you, Mayor. I got to make one correction in your remarks. I hope you forgive me. You forgot Dr. Don Hodder, who was also an original member of our team, and a very valuable one. I'm sure a lot of you know Dr. Don. Anyway, I also want to thank Janet for her presentation. She did a marvelous job. You know, she was very nervous today, but she did yeoman service here tonight, so no problem there. I also want to thank all the members of the family care team who showed up here tonight, and also thank you to Joanne Pelly and her executive team from the Central Zone of the Newfoundland and Labrador Health Services. And most importantly, I think, I want to thank all of you for coming out tonight, because I think it shows the level of interest there is in healthcare in our town. So it's great to see such a good turnout, and I'm hoping that when you leave here tonight, you'll be better informed about the family care team and what it might mean for you. In planning tonight's event, the planning team thought I should speak about my personal experience in getting registered with the team. And so anyway, I agreed to do it. So I'm going to take you back in time just a little bit. It was December of 2021 that Dr. Allah, who was my family doctor at the time, closed his practice. So that's over 2 years ago now. And so my wife and I were left without a family doctor at that point in time. The following month, which was 2 years ago this month, I was speaking to my daughter's mother-in-law, and she said, I just registered for Patient Connect NL, and that might help you get a doctor to replace Dr. Allah. So anyway, I went home, and my wife and I registered. So it's 2 years ago this month that we actually registered. And then in December, I can't remember the exact date, we got a call from the Exploits Family Care team inviting us to register for the team. And on December the 29th, 2023, we both had our appointments to register with the team. That appointment was one, I probably one of the registered nurses that are here tonight, I'm not sure. And I must say it was a very comfortable process, including getting registered in the electronic medical records system, which was mentioned here earlier. And the nurse took notes on things such as what medications I was on. She asked some lifestyle questions, some life circumstance questions that may impact my health. Took a reading of my blood pressure and those sorts of things. And it took probably, I'm going to say 20, 25 minutes, and that part was all done. The other thing that was interesting that I'll mention, and it's probably because of my age, she gave me an advanced care directive form to fill out. And it's something that I thought about, but never really thought about a whole lot. And I said, well, that's a good thing. We should do it. And so anyway, so I took the form home and filled it out, and we were asked, and my wife did the same thing, and we were asked to bring it back to the nurse practitioner when we had a follow-up appointment. So anyway, at the end of the registration process, we were given a follow-up appointment with the nurse practitioner. That was for about 2 weeks out from there. So on January the 10th, I had an appointment with the nurse practitioner on that date, and my wife had one the following day. And when I went home from my appointment, I said to my wife, I said, I think that was the most thorough medical appointment I had since Dr. King Jim retired. And that was, I don't know, 8 years ago or more. I'm sure some of you probably had him as your family doctor. I was very pleased with the appointment, how things were explained, the opportunity to ask questions, and it wasn't rushed. Before I left, the nurse practitioner said she wanted a follow-up appointment with me to go over something, and asked me to make an appointment on the way out for a telephone follow-up. So I was given a date and specific time for the call. It wasn't one of those calls where you have to wait like 2 hours or 4 hours or something for the phone to ring. And I've had a few of them, and I missed them too. One was one morning. The call was supposed to be between 8 and, I don't know, 5 in the evening or something like that. And I had to put the garbage out. So I went and I put my phone on the coffee table. I went out and put out the garbage, and when I came back, the call had come in. I missed it. So this one is a very specific time. It's at 2 o'clock on I'm not sure what date, February 6th or something of that nature. So that's a good thing. She also set me up with an appointment at the hospital for something, and I won't get into all my ailments, but anyway. So within a week, I received a letter from the hospital with an appointment for February the 9th. So that was pretty quick, I thought. Yeah, my first encounters with the family care team have been very positive. It's the first time in 2 years that I now have a permanent medical home. It feels good. And yes, I hope that the new family care team gets ramped up so you all will get the call that I've gotten to be part of this new medical home. I know a lot of you still don't have a family doctor as of now, and given the numbers of people that I suspect are in your situation, it will probably take a while for you all to get to where I am at this point in time, and I recognize that. It took me 2 years, but I'm hopeful and optimistic now that the family care team is up and running, and I know it's in its infancy stages, and with the recruitment of more doctors, doctors for the team and others to join the team, that it won't take you as long as it took me. You know, the team is new. It's getting started, so it's going to take a little while for it to ramp up. But the one thing I can assure you is that the coalition will be monitoring the scale up of the team, and will keep advocating until it meets the objectives that are intended. So I encourage you to take advantage of the question and answer session to seek any clarifications on how the family team works and to provide any comments that are appropriate. And also I encourage you, if you probably got this little card on the way in, that you should take advantage of the opportunity to sign up for Patient Connect if you're not. And if you're not, I think Mayor Manuel might mention this at the end as well, the Harmsworth Public Library has agreed for people to come in if they need help accessing a computer or whatever to get registered. So that's my story, and I'm sticking to it. Thank you.
Thank you, Cyril. I don't believe Cyril mentioned, but there's also a smaller table. The table to the left as you go out, long table, is going to be where you can actually register for a family care team. The table at the back is going to be a table where you can give your name if you would like to have updates and correspondence in the future from the Grand Falls-Windsor Healthcare Coalition, that they can update you on important events or any news that arises. So Cyril does that through email, and it's been very effective because, as I said, the letter writing campaign was a big help, I know, in getting all this started. And you know, I guess Cyril's experience was certainly a positive one, and I've heard a couple of other similar stories. The big issue for people, of course, is going to be getting to the point where you're in there to see whoever is going to be seeing you on the team, and as you move around with different providers. But you know, please be patient as you can be, especially when you're dealing with the family care team. You know, this group of people are just getting up and running. I'm sure they are doing their very best to intake as many people as they can as quickly as possible, but obviously the process has to be followed so that everybody is cared for in the best way. So just keep that in mind, and we will, of course, continue, and we'd ask you to as well, to continue to lobby government for more resources when it comes to physicians in our Grand Falls-Windsor Hospital. And we know that there is a big issue there, but government has listened, and we met with the minister a number of times, and we met with government departments, and I can't tell you how many meetings that we had in the last couple of years about this, but it's great to see that the family care team is up and running. And we've been advocating for this, of course, since the Health Accord was released. And one of the things in the Health Accord that a lot of people may have heard is the term, the social determinants of health. And it is a very important topic that we are focused on now through the coalition. And coalition member Denise Spencer is here to do a short presentation on the social determinants of health. So please welcome Denise.
Good evening, everyone. So I'm going to talk to you for a few minutes about the social determinants of health, what they are, and why they should matter to you. If you're in the field of healthcare or social work, you have obviously become aware social determinants of health is a concept that's existed for a long time. If you work in the volunteer sector and work within the community providing services, you will have seen the concept of social determinants of health coming up in your work and your programming and become a focus for you over the past few years. However, many of you, like me, would be vaguely familiar with the concept of social determinants of health, or it is new to you. So we'll start with a definition of what social determinants of health are. They are the conditions which people are born, live, work, play, and age. These conditions affect a wide range of health functioning, risk, and quality of life outcomes. So in our restructured health system, which we've been talking about, and how the family care teams are part of our restructured health system, the social determinants of health are being integrated or embedded into the primary health care delivery models. So there are two important areas that make up social determinants of health. The first is a social safety net. And in the context of social determinants of health, that refers to a range of benefits, programs, and support that that protect people during various life changes that can affect their health. So the social safety net is meant to ensure all people in society have access to basic services, and the majority of the population can access social safety net programs. The second concept is social exclusion, and this refers to specific groups being denied the opportunity to participate in social life with limited access to social, cultural, and economic resources. So we recognize that there are historical inequalities experienced by some population groups that hinder their ability to access social safety net programs. So let's take a closer look at our social safety net as it relates to the social determinants of health. So there are 6 program areas that are covered here. We're looking at early childhood development, education, housing security, food security, income and income distribution, employment, and working conditions. And I think if you pay much attention to the news over the past year or so, you probably have heard a lot about issues that we have within our province and throughout the country with access to early childhood development, childcare, programming, housing security, and food security have become prominent issues over the past few years. So as it relates to the impact on our health, these 6 program areas are identified, but of course our social safety net includes more than just these 6 programs. And you will notice that some of these services are provided by the provincial or federal government, and some are delivered by non-governmental organizations, faith-based groups, and volunteer organizations. So there's a number of different programs and services people would access in our community through a number of different service providers. The second area of social determinants of health is the exclusion factors. So let's take a look at what is identified here. In the healthcare context, those factors are Indigenous identity, race, immigration, culture, gender, disability, and geography. These are historically disadvantaged groups that may face barriers to accessing social safety net programs or encounter discrimination when accessing social safety net programs. If you identify with one or more of these factors, you may not be able to access social safety net programs as fairly as the general population does. So why should you know about the social determinants of health? For our purposes tonight, I've identified 3 reasons. The first is that the experts tell us that social determinants of health have 60% influence on our health. So to be clear, our social safety net programs and social exclusion factors have 60% influence on our health. The health system accounts for 25% of our health, and our genetic makeup and biology account for 15%. So given that the social determinants of health has such a large influence on our health, if our social safety net programs aren't as strong as they should be, or if social exclusion factors are existing, you can expect worse health outcomes than the general population. Reason number 2 is that when you receive health services from a family care team, you may be asked questions about some of the social factors related to your life because the health system is refocusing to include consideration of the social determinants of health and how they impact you. Primary care providers will look not just at the presenting issue, but also at your life circumstances. And just as a very basic example, I guess to help us illustrate this, if somebody were to present to a family care team and they had the issue of frostbite, so in your care, they wouldn't just treat the condition, but also ask questions about your social determinants of health. And in doing so, they may discover that you're experiencing homelessness and are sleeping outside, and that's what caused the frostbite. So you want to get beyond just what the presenting issue is and find out what's more of the causes of those health concerns. Reason number 3 why you should know about the social determinants of health is that our Exploits Family Care Team has a social worker on staff, and that social worker can assist you with connecting their clients with social safety net programs where they are needed. So to take you back to our example of the first person with frostbite, if the condition they have is linked to the lack of housing, they can be referred directly by the social worker who can help them find housing programs such as Newfoundland and Labrador housing and other services within the community that it can help you address the housing issue. And in that way, we're not just treating the issue itself, but also hoping to prevent a recurrence of it as well. So what can you expect to see from the Grand Falls-Windsor Community Healthcare Coalition? What will we be doing to address the social determinants of health in our community? As you've heard already, much of the coalition's focus over the first year and a half has been on ensuring the implementation of the redesigned healthcare system results in the best healthcare services possible for our community and our region. So now we're focusing to also include social determinants of health. So we now have a working group that we've developed, which is focused on social determinants of health, and that is made up of some of the coalition's members. And we've partnered with stakeholders in the community that are well positioned to help us advance our work in this area. The working group will reach out to program and service providers within our community that deliver social safety net programs, and we want to ensure that our community has adequate and accessible programming available. So given that the social determinants of health have 60% influence on our health, we want to ensure that we have the most robust social safety net programs possible. The Social Determinants of Health Working Group will be reaching out to groups in the community that experience social exclusion to inform our work and to partner with them to work towards a more inclusive healthcare system in Grand Falls-Windsor. We will work to ensure that no one is left behind and that we address historical inequalities that have or may exist as they relate to access to social safety net programs. We want to collect information from both the community members that experience social exclusion and the social safety net service providers to identify where services are inadequate or where social exclusion is occurring so that we can identify specific issues that need to be addressed and target our advocacy to address those concerns. We want to find and fix gaps that may exist so that no one falls through the cracks in our social safety net system. Finally, we want to facilitate safe and respectful dialogue between populations that have been experiencing or at risk of experiencing social exclusion and the social safety net service providers, and bring them together with our healthcare service providers to ensure that our community transitions well into the redesigned healthcare system. If it's not already being done, we will work to bring social safety net service providers and socially excluded groups into the discussion with health service providers to close any communication gaps that may exist and promote inclusive and informed decision-making as it relates to the social determinants of health. So what's next for you? Stay tuned to the Town of Grand Falls-Windsor's communications for opportunities to connect with the Community Healthcare Coalition's working group on the social determinants of health as we advance our work in this area in the coming weeks and months. If you have specific interests in this area and would like to initiate conversation with us, please contact us at our email address, which is gfwhealthcoalition@gmail.com, and we'll get back to you and begin to part of our engagement process. Finally, I just want to say that I say all of this to say that since the social determinants of health has 60% influences on our health, we all benefit if we have the strongest and most inclusive social safety net programs possible. If you want, I look forward to further engagement with our community over the coming months to work towards achieving that goal. Thank you.